Hi everybody, this is Dr. Jill Ellsman, and I will be one of the faculty members for this course, N460 Community Health Nursing. Professor Cassie Flock from the Jasper campus will be teaching the course along with me, and I sent you an announcement regarding the division of students. She will have part of the group and I will have the other part of the group. So if you have questions or concerns, obviously you can ask either one of us. But just know who will be grading your papers and the primary contact person for you to go to, if at all possible, so your questions can be answered. Starting here on the home page, you can see where the announcements will pop up, and then also you can link to the announcements page. Here you can see the assignment of students. Just remember that Blackboard and Chrome tend to go together. Blackboard doesn't do as well on some of the other search engines, so make sure that you use that. All faculty are required to hold virtual office hours, and I'll show you where the tab is for that. This just kind of explains how we're doing that. Mrs. Flock and I will each have our own virtual office hours site, so you can click on that tab and find the appropriate one. And you can see where my virtual office hours are, and I'm sure she will announce hers as well. So feel free to hop on during those office hours to collaborate, and we can share the desktop, we can just talk. Any questions you might have, it's just another opportunity to connect with your instructor in some way, because the university does allow us to have 2 office hours virtually, so we'll always be on our computers to have access during that time. We realize that a lot of you don't have that type of schedule where, mornings work for you. So just know that we'll communicate with you and work with you any way we can to find a time to communicate if you need to discuss something or have a question about an assignment. Okay, so we will be posting announcements on Blackboard every week at least. We don't mean to be stalkers, but distance education does require that we connect with students at least once a week. So you'll hear from one or both of us at least that often, and we may send you individual emails since, again, we split up the group for grading. All right, assignments. This is in alphabetical order, so just know that when you need to submit an assignment, like your analysis of bioterrorism plan paper, your health promotion paper, or your windshield survey paper, that they will go here. We'll also be submitting some things on discussion boards, so hopefully that is clear in your syllabus what needs to go where. And again, if you have questions, let us know. Okay, obviously if you're listening to my lovely voice, you have found the orientation. I haven't put it there yet, but I will when I'm finished. It will go here. So please take the time, if you will, to listen and to take notes and ask questions as needed. I know I talk fast and I go through things rather quickly, but I know you're adults, you can all read, but I do try to bring up points or things in the course that historically students have had questions about. We are kind of unique in the fact that we are a baccalaureate program, but all of the faculty are full-time faculty and teach on campus. So please refer to your nursing advisor for any questions or concerns. There are distance education advisors also, but in nursing you will connect with your advisor that is listed on your degree works in MyVU. If you have any other questions about online, just know that there are some links here, and these are standard for every distance education Blackboard course that we provide these for you. Faculty information. So far it's just me, but Mrs. Flock, I'm sure will be adding her things soon. I do have her email address for you. My office hours are posted from 8 to 9, Monday through Friday. That may not be convenient, I get it. I'm also ASN chair this year, so I kind of had to get my office hours done so I could conquer other things that came my way in ASN. But again, just email me or call me and leave a message, and I'll be happy to get back with you. Email is the best way to find me. And then I do have the virtual office hours as well. And like I said, Mrs. Flock will have hers up, I'm sure, very shortly. So here are our virtual offices. Here's a little tutorial. Resources is like 3 minutes long. It's super duper easy. I'm sure you're all much more tech savvy than I am, so you may not even need the tutorial, but if you need it, there it is. And then just click on the respective link for the professor that you would like to collaborate with during those hours. You may be asked to type in your name. And And mine is for all of my courses, because like I said, this is a great idea through distance ed, but I don't have a whole lot of students connect with me this way. It's usually through email or a phone conversation, so I don't know why that is there. Yeesh. I don't want a survey, so yeah, probably don't want all this stuff. Let's see if I can go back. Let's try again. Oh yeah, there's the webcam. Okay, we don't want that. I had that off, but okay. So anyway, you can, be on here video, or just go straight to chatting. So you can see the little comment box. There's one person in the room, and then, like I said, we can share a desktop if we want to. So if you'd like to do something techie like this just because it's interesting, I will be here on the days that I stated. Okie doke. So that is virtual office. Oops, sorry, too many things open. Okay, syllabus and schedule. This is probably what you're most interested in. I do have the Common Course outline here. It's just something we use for accreditation, that no matter where we teach this course, we use the same basic shell for the course and then develop our course per academic freedom following the guidelines set by VU and distance education. But the one below it is the one you're interested in, I'm sure, and that is the actual syllabus. This is a 4 credit hour class, 3.5 class hours and 1.5 clinical laboratory hours. So Mrs. England has a site set up. You've probably gotten emails from her already because she's always Johnny on the spot with those regarding your clinical time. Please refer all clinical questions and concerns to Mrs. England because that's her deal and she is most expert at it. We do ask you to do a reflection discussion board at the end regarding your clinical experience, and so that can come straight from your journaling from Mrs. England. It's not necessarily a whole lot of extra work because we really do like for students to be able to share where they went to clinical, what they experienced. This is probably my favorite thing about the class because it's basically service learning hours or volunteering your time to vulnerable populations, considering that this is community health nursing and we're looking to promoting public health. And many times one of the biggest risk groups in public health are vulnerable populations. And I'll talk to you more about what I mean by that shortly. And you'll be learning about that also throughout the semester. So please contact her if you have questions or concerns. And like I said, she does very well with clinical and will guide you through that process. Just make sure you're communicating with her regarding, getting clinical set up and then the actual clinical hours. Okay. So our contact information is here. Mrs. England's information is here also. I'm just going to kind of go through this. I know you're big boys and girls. You don't need me to read it to you. The course description, the course designation, and then our course outcomes. I will read these because they're very important. Assess the healthcare needs and practices and disaster preparedness of a population. And we tie these to essentials and program outcomes. Again, this is an accreditation requirement. There's a lot of things required in education, so tying those outcomes to our course outcomes is very important to make sure that we're not just teaching you things because we think it's nice. It's because it's best practice and evidence-based practice. So you don't have to do anything with those. Just know they're there because we're definitely wanting to give you, best practice courses. The second one is develop a plan to promote health, prevent disease, or prevent injury at the population level. Analyze the nurse's role and responsibilities in an emergency preparedness and disaster response. Identify methods to address health disparities of vulnerable populations. And discuss appropriate health education techniques. So you're expected to participate in discussion board postings and responses. Display APA work proficiently as evidenced by the rubrics. Provide honest and constructive feedback to peers in a respectful manner. Analyze components of health promotion. Develop a windshield survey of a chosen community. And critique the components of a disaster bioterrorism plan. The required textbooks are Rector 2018. This is a brand new textbook as of last year. So if you have an older version, I have to tell you it's probably not going to work because this textbook is very different. Sometimes you can kind of slide by with an older version, but I found that students tried to do it because we have so many of the page numbers and chapters tied to the assignments that it was just too difficult and they had to go get a book. But you can rent it. And now I've used this one, I think, for the last year, so there should be used copies out there someplace. And of course, your lovely APA manual. Obviously, you need a laptop with microphone, Microsoft Office, internet access, the Blackboard site access, and the handbook, and the most current handbook it is posted on the site. The grading policy is the same for all programs, and then you can see here the assignments. I'll go through all of them, but discussion board activities, windshield survey, health promotion paper and draft to peer, health promotion paper, peer critique, health promotion paper, health promotion presentation, and peer response. Do you get the idea that health promotion is important? Yeah. And then analysis of bioterrorism and disaster plan paper. Okay. Do know that we may keep assignments to display for accreditation. Assignments will have a 5% deduction per each 24 hours if they are late. You're expected to review comments, and if you go into My Grades, you should see the feedback that we leave for you as a blue hyperlink that can be clicked on, and you should be able to open up and see assignments. Rarely do I grade a paper and I don't leave some sort of comment. Sometimes on discussion boards, if they're pretty straightforward, I might not. I mean, you'll get your grade and I might say a little something, but otherwise we spend a lot of time grading papers, not only to help you with your APA and grammar, but also to help you understand the comment or make comments regarding maybe something you said that was interesting or that we didn't know. So, it's up to you, but I would highly suggest that you look at those comments because they can be very helpful to you in subsequent courses as you progress throughout the program. All right, we check for plagiarism and safe assign. So if you're getting high results, usually higher than 31% or so, then you better be looking at that. Maybe you just didn't cite something appropriately. Hopefully you're not using a friend's paper, because if you are and it's in the database, that is plagiarism, and that can jeopardize you into failing the class. So don't do it. It's not worth it. If you get a high percentage and you're freaking out about it and you want to resubmit, contact your professor. Otherwise, hopefully we'll see low safe assigns, because some of these papers are individual to your communities. Some of the bioterrorism plan papers I've noticed come back a little bit higher on safe assign because people are using the same disaster plans from hospitals and things. But anyway, it still shouldn't come up someone else's work. So if you have questions on safe assign, let me know, because obviously it's kind of important. Okay, so other course policies are listed here. I'll let you read through those. Nothing really unusual or different. And as I said, the current handbook is listed on the Blackboard site. I know we don't meet in class, but again, a lot of those policies are just standard policies. So if you email us, please just state what course you're in and sign your full name. Some of the emails that people create for themselves don't really give a clear picture of who you are, and some of them are very creative, but just want to make sure that we can get back to you in a timely manner if we know who you are. Okay, clinical activities. You will need to read chapter 25 in your textbook. This chapter discusses vulnerable populations, and that will help you as you maybe plan where you would like to go and who you'd like to serve in your community. Identify agencies in your home or work community that provide services to a vulnerable population. We've given you some examples, and they're all in that chapter reading. Choose an agency of your choice, and submit to the clinical faculty for approval. You can pick up to 2, so maybe you want to do some clinical time in one spot and then go to another. That's fine. Once your request is approved, you can attend, and you need to submit journals, outcomes, and then your clinical experience summaries per the date set by Mrs. England. These are some examples of places people can go, but again, Kathy has to approve those. There may be a reason why she would or won't. These are examples from your book, but some may require an orientation or a contract, so we just need to know those specifics before you go. Okay? You have to be a registered nurse to be in this class, or for some reason you do not have your nursing license, you need to talk to your advisor because you should not be in the course, because clinical agencies are expecting you to come as an RN. And we will ask you to submit a discussion board on this, like I said before, just so you can share your knowledge with other students. It's really interesting to hear where people go and kind of experiences that they have. I've really never read one, honestly, that was negative, and usually students are pretty honest. I think they've really enjoyed their time. And some people go back to volunteer and do things, long after the class is over. Do you know you have to pass both clinical and lecture to pass the class? Okay, the windshield survey, you can see the criteria here, and information about the windshield survey is in the textbook on page 529. So you're going to review that criteria, and then you're going to go through your community, and you're going to basically answer the following questions and formulate a paper. So just read the instructions carefully. You're also going to refer to Healthy People 2020 and determine the greatest need in the community. I think what's really great in this assignment is we have people that live in rural areas around Vincennes and Jasper, even smaller communities than those. And then you have people that live in Evansville, Terre Haute. We've had somebody in Nashville, Tennessee. We had somebody from Indianapolis. So it's really interesting to compare and contrast the different communities because you have a discussion board on this as well. Okay, so follow the criteria. Let me know if you have questions. And then the Analysis and Bioterrorism Disaster Plan paper. The criteria for that is on page 506. So please review that, understanding that not all organizations have a real clear disaster plan. Some of the ones that students submit, they're like, wow, there's a lot of holes here, and this maybe might not have us ready if a disaster happened, and we know that that can happen. And it has happened. So please look at the terrorism information there, and like I said, you're going to review your policy, and you're going to figure out what's missing and what's there, and go from there. Okay, so let me double check something else here. There's some other information on disaster plans on page 594 to 622 that also will be helpful to you. As far as emergency preparedness, this is more of the bulk of the reading, so you'll be able to look at that as well, and to be able to hopefully write a paper on all this information, what's missing and what is present in your plan, and what could be improved. And you do need to cite that plan. Sorry. Make sure that you tell us where you got the plan from. I think here it says textbook references as appropriate and reference for facility disaster plan needed. So if I'm using Good Samaritan Hospitals, if I'm using Vincennes Universities, because we actually have one, then I need to cite that so I know where you got it. And you need to plan ahead to make sure you can get that from your supervisor, out of your handbook, at work, or maybe off of the intranet, so that you can answer that. Because I can pretty much tell if somebody has read the plan, really read the plan, because I've read enough of the plans from all the hospitals around here that I kind of know what's in them. So you're not going to be able to BS your way through that, oh, I really didn't read the plan, but this is maybe what I think it would say if I did read it. So just a friendly reminder, read it and cite it. Okay? If you're having trouble finding one, let me know. We've done other things. Students have actually critiqued the use plan. I had a student that found one online from another hospital she wanted to do. So it worked out. Okay. Health promotion paper directions. This is talking about the draft of the health promotion paper. So please read this carefully. Okay. You are going to trade papers with students. So make sure that you are trading back and forth. So if I'm the first student to post, and Sally posted next, then Sally and I are going to grade papers. If John and Mary post third and fourth, then John and Mary are going to trade papers, okay? I've tried this a couple different ways. I'm going to try that because I did just the trading papers and it worked okay, and that way you already have a dialogue with that student. I've tried to go down the line and have, Susie critique John's and John critique Mary's, and I don't even know. Sometimes I just think I need to assign it, but I'm thinking we're going to try it and we can do it. Okay? If you're not sure, let me know and I'll tell you what to do. But do not post late because otherwise it'll mess it up. Okay? and don't post after till 8 a.m. on the date that it's due. So all papers are posted before trading begins, because then people add their papers and somebody gets lost in all of that. Okay, submit a complete draft. I couldn't believe it last semester. I actually had people who were submitting like just a cover page and a paragraph. That is not a draft of the paper, and I was kind of upset that that student, several actually, thought that it would be okay to send that to another student to critique. The student's like, well, good job on the title page and the introduction, but where's the rest of your paper? So I will be looking at the drafts to make sure they're at least complete. I don't expect them to be perfect, but you need to have something down, because I'm not just going to go through and give points because you posted it on time. I'm going to make sure there's at least a paper there for someone to review. Just when I think I've seen everything, then something new and exciting happens, and that was last semester. First time I'd seen that. Health promotion paper, again, following the guidelines. You're going to cite the book. You're going to look at Healthy People 2020 objectives. You're going to look at page numbers in your book related to health promotion and what exactly that means in community health. So make sure that, looks like I was eating something because my pages got stuck together. So make sure you look at that, and that'll help you as you're planning a health promotion project through this paper. Obviously, it's not something you have to do, but it's something that you would want to do. You've identified needs in your community, so the next piece of that is going to be to figure out how could you address that problem in your community. Okay? I think just following the rubric, it's pretty straightforward. I don't know what else I need to say about that. It's all pretty straightforward. Okay. Health promotion PowerPoint with audio. You're going to actually take that paper and you're going to do a presentation on it. Because again, it's very important to understand the needs of a community, and then try to think about what are realistic interventions that could occur that could improve that. Whether it be mental health, whether it be teen socialization. I have a lot of people that write about, teen drinking in their communities because there's nothing else to do because you're in a rural area. So everybody goes and finds a barn and drinks. So there's a lot of that. Meth use. I've had a lot of people talk about that. Access to mental health services. The homeless. So, again, trying to identify that, tying it to a Healthy People 2020 objective. And then, what can we do about it? Because obviously as nurses, we should be advocates, and we should try to be world changers, even if it's in our own little community or in our own little corner of the world. Okay, so again, I think that's pretty self-explanatory. Tells you what to put on each slide, so it looks to me like that's pretty straightforward. You're going to respond to 2 other students. Ask questions. You don't have to cite a source when you respond to them, but, be thinking about some things that maybe they haven't thought of that you could add to the presentation. Okay, and then you're going to respond to the questions posted to you, and those activities are each worth 10 points. Okay, the next part of this are the discussion board assignments. Discussion board 1 is Healthy People 2020. And so again, I think this is pretty straightforward. It tells you what you need to do, where you need to go, and what you need to write. So make sure you're looking at that. I would also advocate that you go to the Healthy People 2020 site and look at the indicators there. There's a lot of information on that Healthy People 2020 site. Okay, it tells you if you need to respond to peers or not. Discussion board 2 is epidemiology, communicable disease control. Again, this is a formal posting, so you need to cite sources. It gives you the readings, and then you need to, refer to a journal, and then respond to peers. So make sure you follow all the components of the discussion board. Discussion board 3 is health disparity. Again, what is a health need or disparity you discovered on your windshield survey? So you're going to kind of share those. Interview 2 community leaders regarding that health disparity. Let me clarify something here, because I just kind of realized when I read that there is an issue here. For the discussion board, you're going to interview 2 leaders in the community. It could be someone at the hospital. It could be the mayor if you know them. It could be a longtime resident. It could be somebody that's in that community. But try to, discuss from this community leader. It could be a formal or informal leader. Why, what they have to say about that What is their opinion? How do they feel healthcare is being influenced by this need? And how do they think this affects healthcare financing? So you probably want to ask somebody that maybe could answer to that really well. But I want to go back to the, pardon me, just look away for a minute so I don't make you dizzy. But I want to go back to the paper. Because what I see students do is when it says, oh, where's it at? Let's see here. Oh, under literature review number 2, when it says content of paper, it says use at least 2 professional references. This is not the 2 people that you interviewed. These are actual references. It could be a website, it could be an article, it could be a journal, but it has to be scholarly to support a program or plan that might work in your community. So for example, when I was in school for community health for my DNP, I had to pick something, and I picked childhood obesity in the schools. And so I wanted to look at, because in the state of Indiana, you're not required to have PE classes in the school. So all these kids could just sit at recess and do nothing. They don't get a PE class because it's not required, because then you might have to pay PE teachers. So these kids just sit around and they become obese. That's one major factor. Obviously, there are others. So I looked at programs, best practice programs throughout the country that addressed the issue of childhood obesity and inactivity. And I can't remember the names of the programs now, but there were several that communities had instituted. One I think was through the YMCA. Another one was another after or during school program where these volunteers came in at lunchtime and they did guided activities with the kids. Because, like I said, a lot of kids aren't going to go play on the playground; they're going to go sit. Whereas if you have organized games and activities, then those kids are going to be active during that time of recess. So I was able to find those 2 evidence-based articles that had statistically significant results of success to address childhood obesity. So don't confuse that. I've had people do that, and I've had to take points off where it says professional references, because you may not be interviewing a professional, right? You may be interviewing somebody who's not in an official political role, but is somebody in good standing in the community that can give you the feedback that you need. So close your eyes. I'm going to scroll again, but I wanted to bring that up because I've noticed that a few times, and maybe I need to word that a little different. But it is what it is for now, so I wanted to make it clear. Okay. Okay, let's see here. So, that's the health disparity discussion board. Discussion board 4 is behavioral health. And so it's going to be assessing the behavioral health services in your community, what you're finding, what you're not. A lot of people are finding that there aren't a whole lot. If you're looking at websites like hospital websites, Chamber of Commerce websites, make sure that you cite those, okay, and make sure that information is then in your discussion board. Just don't guess and kind of think, well, maybe they have some, I don't know. So you have some readings there to go to, and how they were met or how they weren't met. Transcultural healthcare disparities. This is a different culture other than your own. There are some in Chapter 5, but there's others that you could find online if you wanted to, or other information other places. Maybe you want to pick a different culture that's more local. We're not exactly the melting pot here in Knox County or DuBois County, but a little bit. We have some different cultural influences versus obviously somebody in a large city like Chicago or Indianapolis. They're going to have a lot more. But pick one that is interest to you, how you would provide care, and make sure you reference your information. And then you're going to respond to each other so you can learn about other cultures too. And I would challenge you to step outside. There's nothing wrong with talking about the Hispanic culture, but I think a lot of people do that. Maybe pick one that you don't really know a whole lot about and you would like to know more about. Again, I'm not saying that that's a bad one or anything. It's just it seems like a lot of people do it, and I'm hoping we can get some variety here of different cultures. Okay, but if you are dead set that you want to do the Hispanic culture, that's fine. But just hoping some people will choose some variety. I will not take points out if you don't, but think about somebody or a culture that's new or different. Global health and risk factors. You will do some reading on that, and then you will do some discussion boards. So again, as a public health nurse, how could you address some of these issues that are more global than just, obviously our towns, our communities, our states, our country, thinking big, what else is out there? And then you're going to respond. And then the last one is basically just reflecting on your clinical experience. So when you're finished with clinical, you can post this one, and then you're going to respond to 2 peers. But it's not a hard one, I don't think, at all. Okay. And this summer, we added a question about how do you feel like this experience met the course outcomes for community health. So I am going to add that one on here. I see it. It's not on the syllabus. I think I just added it this summer and didn't add it to the fall one. So just know there'll be one more question on here. I'll have that available, but you don't need this one for a while. So it'll be fixed by the time you get to it. Okay? But just know there'll be one more question. All right. So week 1, you see the orientation. Week 2, you see your assignments and postings. Everything is pretty much due on Fridays at 8 o'clock. So please just notice that. You can see when the papers are due. The drafts and the critiques. We have fall break in here. Health promotion paper and PowerPoint presentations. So maybe you can spend a little time that fall break week getting those ready to go. Discussion board, your response to health promotion presentations. Peer response to discussion boards, posting of the discussion board, the bioterrorism papers on week 14. Again, discussion boards and responses, and then that final discussion board. So make sure that everything is posted by Wednesday, a final exam week at midnight, so we can get grades turned in. I know people like their tuition reimbursement money in time for Christmas, or just want their grades and want to be done with it and enjoy their break and not worry about it. So we can do that a lot easier if things are all finished and tidied up, so we can post grades. So that's the syllabus. And like I said, I will add that one item that's not there, but I think everything else is good to go. As far as the content, we did provide you with the handbook. The Institute of Medicine report is a good resource for health disparity information. So you might want to use that for those assignments. And then we just included the PowerPoints. You don't have to look at them, but they came with the book, and we feel like we should give you whatever it is that you're paying for. So if you want to look at these to help guide your reading for any reason, have at it. They're all here. Okay? There's a lot of ways to get to email through Blackboard. Here's one way. You can either email your faculty or the other students in the class if you need to, especially for that peer review. If you need somebody's email, you could do that here. You can also do it under tools. I'm going to hop down here a minute because all of the course tools are here as well. So there's a couple different ways to get into things. The discussion boards are here. So the information is all posted on the discussion boards, just like it is in the syllabus, for you to review and then to post your thread. I must have done a lot of copying and pasting because there's a lot of gray in there, but I guess it just gives it contrast. I don't think it hurts anything, but I might try to fix that. Otherwise, it's there. Okay, grades, again, these are your upcoming grades, and they are attached to rubrics, and we grade them. We'll also use rubrics. Some of the discussion boards are just discussions. They're not tied to rubrics, so we'll just give you feedback. But also check in this section because you'll find the blue links where you can click on them to see faculty feedback on your papers. The VU library, you should be really good friends with the library because you're going to need some resources. I think they modified this site this summer, but I think it's still pretty easy to use. You can do one click that searches everything. If you like CINAHL and ProQuest, you have the opportunity to search databases A to Z. Just make sure you know that when you're off campus, you have to log into MyVU to get to the library. But there are hours for the library. You can email or call a librarian. The VU but databases are very good. They have a lot of full text. So make sure that you take advantage of that. If you're needing something, you should never have to pay for anything. There should be enough here that you can get full text articles as you need to. And then this clinical survey link, close to the end of the semester, you will get that so you can evaluate the course. And then I think VU has a university evaluation that they'd like for you to do. So I know I talk fast and that's a lot, but I'm thinking 35 minutes is enough. And again, please just review everything very carefully. If you have questions, please let me know. I've done my best to make sure that everything is set for you, but if you notice something that seems a little squirrely, let me know. But I do look forward to the semester with you. I know Mrs. Flock does as well. And we'll be emailing again soon. Thanks. Take care.